Welcome to week 2 of RN Health Assessment. This week we'll be talking about your approach to the clinical setting, vital signs, pain, and nutrition. These would include chapters 8, 9, 10, and 11 in your textbook. Please remember to review the videos that are associated with any of these chapters for health assessment. So your general survey, as it says, is the study of your whole person. So you tend to do that sometimes without thinking about it if you're an experienced RN and have been working for a number of years. Remember to go over that and think about that assessment a little more closely when you have that first encounter with your patient. We'll discuss some of the assessment techniques in the clinical setting. Your health history, which you completed last week, that's complete and done. You should now move on to physical examination and your general approach. Think about your emotional state and that of your patient. That can make a very big difference because when you come into a patient, if you're frustrated with something that's happened in another area or outside the room, that can carry over into your discussion with this new patient. So you need to be very aware of yourself and your state of mind when you enter a patient's room. Remember the hands-on approach and the cultural differences that may occur because of that. Use all your senses when you complete your assessment. You have 5 senses, you will need to use them, including, believe it or not, the sense of smell and taste, because sometimes you walk into a room and your sense of smell and taste are integrated into each other, so those are very necessary when you assess your patient. Skills that will be performed one at a time and should be performed in this order for the reasons that you've probably learned back when you were completing your RN degree. Inspection, because it's the least invasive. Moving all the way through to palpation, percussion, those depends on what area of the body, which order you'll be completing them in. Because you want to move preferably from least invasive to most invasive. Now, palpation, percussion, if it's on the chest, you may palpate first and auscultate last. If it's the abdomen, you may auscultate first and palpate last. So those are things to think about based on the organs and the areas that you're assessing. You always have objective data. These things, physical appearance, your body structure and mobility. How is that person behaving when you walk in? Some of the things to think about with their vital signs. What are they're talking about how sick they are. Just because they're playing and laughing does not mean that they're not sick. So you need to assess for other things. Their height, weight, BMI, their waist to hip ratio, their vital signs, including their orthostatic or postural blood pressures. Remember, developmental considerations come into play depending on whether they're an infant, toddler, young child, adult, or an older adult. So those are always things that we need to consider when we're completing an assessment. Pain, you need to think about the anatomy and physiology of pain. Then how are you going to assess it? There are different pain rating scales, especially for age and developmental considerations, and then also pay attention specifically to the nonverbal behaviors a patient may show based on culture. Your nutritional assessment, there's some new things to say that are being said about nutrition and our inpatients, and that we really need to be aware of the under or over nutrition of our inpatients, and sometimes we're not always as aware of those things as nurses on the unit. We feel that that's the dietitian's job, and it's not. It's a nursing function. We need to pay attention to how our patients' nutrition status changes. Thank you. Have a great day.